You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Facial makeovers today with permanent makeup artist Sheryle Taffola. Sheryle, welcome to the program.
Thank you, Randy. I'm happy to be here.
Now, you've been on my program for how many years?
I believe 8, if not more.
It's been a long time.
It's been a long time. Roll buds.
And you're still not, and you have, I guess, we didn't do any makeup on you today.
We didn't do any makeup on me today except powdering me down so I don't look shiny.
Okay, and I didn't do the powders. You must have done it before you were here because I didn't see you.
No.
Now, and I also don't endorse people. I try not to endorse people on the show, but you're one of the people that, you know, if anybody talks about it, permanent makeup, I always say go to Sheryle Taffola. I mean, you have a good reputation. You've been solid, what, 22 years now?
Yes, and I've worked very hard to be so.
Okay, now, you're a permanent makeup artist.
Right.
But do you do more things?
Yeah, we do offer other things at our facility. We have a girl that does electrolysis.
Okay.
We do lash extensions. We do hair extensions. We do things to make girls feel pretty and better about themselves. You know, you got to feel good. You got to lift yourself up right now in this time.
All right. Now this is now there's art to this, by the way. Just like, you know, tattooing. You know, there's guys in LA with reputations as like the best guys.
Tattoo artists also have becoming more aware of layering in color. In other words, if you try to put a tattoo or if you try to put an eyebrow in all in one session, it looks very harsh and it looks very tattooed.
Okay.
Especially on the face, we want 360 opposite of a tattoo. When you're doing a body tattoo, because I do those as well, we layer in primary colors very solid because you want that look. We do a lot of shading, but in the face, you want it natural. A lot of people will say, well, why do you have to go for 2 sessions? I can get it done in 1. But if you get it done in 1, it's like
brows in particular.
Yeah, it's like faux finishing a wall. If you have one color, it looks good. You put another color in there, it looks good. You add that third color and it starts to pop. And that's what you want. Good permanent makeup, you shouldn't even be able to tell a person has it. If I saw you on the street, you'd never know I had it. And that's what you want to achieve. Can you do that in 1 session? No, because you're trying to put one color in the skin and it just looks flat. If you layer it in, I'll see usually 2 times. 3 times for lips. If you layer that color in, it just pops out of the skin. It just looks like that's how you are. It doesn't look like you have makeup on. It doesn't look like somebody took a magic marker and drew on your brows. It's 3-dimensional.
But does that happen? Does that really happen?
Oh my gosh, yes.
Is there a lot of bad
very
work out
frustrating.
there?
Yes.
You said I don't want to go negative, but I mean,
I don't want to go negative.
Is there bad work out there?
Well, of course there is. I mean, I'm sure you've seen people and why do they wear their makeup like that? And a lot of it is bad tattooing.
So a lot of women in their 60s, 50s, was very young today. Very thin brows.
Very thin brows.
Good point. So they get up in the morning. They know what they look like.
Right.
But I guess it doesn't make them feel too pretty.
Well, we all look better with some type of enhancement, I feel.
Okay.
And I am layering in a beautiful enhancement that no one knows they have, and they just look good. It races a good 7 to 10 years off the face. So the cosmetic surgery, they go and have that done, and then I come behind them, I take another 7 to 10 years off the face. It's a win-win.
But the big fear is that it's not going to look natural. Even your daughter-in-law was worried about not looking natural, and I saw her.
Yep.
Very, very nice. You said, look at her brows. I mean, you were proud of it. You said, look at those brows. Aren't those beautiful brows?
Beautiful, yep.
Okay.
That's because you layer it in.
But even your own son was worried about it.
He was a little concerned. Mom, don't mess up.
Okay.
And I didn't. She's beautiful.
What do women like most about the permanent makeup that you're doing? Is it more of a convenience? Do they feel like they look better? I mean, what is it?
Freedom, number 1, to not have to do it every day, but we will do anything to look better. We are the female species.
Okay.
We will do whatever it takes to look better and to save us time and energy, because women that are on the go, all women work these days. They're trying to work, they're trying to juggle children, they're trying to get out to the soccer game, they're trying to get to dance class. One less step that they can kind of cut out and still look good is amazing.
So lips, brows, and eyes are the most popular?
Those are the 3 popular ones that are right on your face that you see first thing.
Because you don't do blush, right?
Blush and eyeshadow are done. I do not do them. I do not think
Is it really a popular area of the face to do?
Well, you know, so let's say you have blush done, and then, you know, you decide you're going to have laser done, or you're going to have a little tuck. Where's that blush going to end up? Eyeshadow, the same thing. They're going to put that eyeshadow in there. Say you have a bluff. They're going to cut right through that tattooing. Where is it going to end up? I will not do anything that I don't feel should be done, because I can see later on down the road that might be a hindrance. And I always explain to people, well, I want eyeshadow and blush. I said, well, I can't, I can do it.
Okay.
But I won't do it.
So lips, eyes,
And
brows, and you are the desert's leader. I mean, you are known as the person to go to when you want natural results.
Right. We also do a lot of scar tissue. We do a lot of parasurgical stuff.
Yeah, give me the categories of the clients that you see. So the surgical patients.
We do the surgical for scar tissue. It's a lot of
breast
cosmetic
aug,
surgery.
or breast reconstruction, facelifts.
Yep. We do facelift scars all day long because when you have a lift, you have a cut in through here. It comes right in front of the ear, behind the ear, and up in the hairline. What we can do is go in with a flesh color and just camouflage that so you can't even see it. That way they can wear their hair up. Lots of times women, or if they have really short hair, they're like hindered now. I can't wear my hair up, I have these scars. So we just go in and add a little flesh in there, and that gives them the freedom to go on about their business.
Okay, now when I met you 8 years ago, I thought, okay, permanent tattooing, permanent makeup, I'm not going to have her come on the show.
You were pretty tough.
And I said, this is not a wellness issue. And you said, Randy, there's a lot of women with Parkinson's. There's a lot of women with arthritis.
That's right.
Shoulder, problems in their 70s and 80s, which in the desert is very young.
Exactly.
And these are the people, I guess, that are ideal candidates for brows, eyes, and lips.
Right, and macular degeneration, people that are losing their eyesight.
Oh, good point.
Oh,
Interesting.
yes, we do that all day long because they want to look good, and they feel self-conscious because they can't see themselves. And so I have clients that come in every 6 months, whether they need it or not, just to freshen it up because they can't see, and they depend on me to be their eyes, to know that they look good, that they look presentable.
Okay.
That's
So you would like to see more of the 60, 70, 80-year-old people that, they have problems doing their makeup.
Oh, that's so rewarding. I mean, anytime you can help somebody is a rewarding thing.
Do you have photos of 70-year-olds that you could show other 70-year-olds, other 80-year-olds?
Oh, thousands.
Really?
Yes, I've done 19,900 and some odd women. We have pictures of everything. Absolutely.
Do you think look, I never ask this on my show, every once in a while.
Oh,
do you
here
think
it
you're the
comes.
best? I mean, do you think you're like at the top of your game?
I know I am.
Really? Well,
Yeah.
good for you.
I feel that I am.
Okay, good. You're big on brows, as far as
Big on
technique.
brows because they're the frame and they're the anchor to the face. They are the expression to the face. They are everything about the face. If you don't have eyeliner and lipstick on, you feel like you don't have your makeup on. But if you don't have brows, it's very troubling.
How long have you had your brows? I'm sorry to interrupt.
Since 1988.
Okay, because they're nice. See, and they don't look too high. You don't look done.
Surprised.
You look very nice. I mean, your brows are nice. I mean, they look good,
And all brows are
natural.
different. Everybody has a different face. Okay. Everybody has a different bone structure. So everybody's brows are different. Every color of brow is different. I don't know if I've ever used the same color on two people. So I'll take 3 colors and blend them separately into the skin instead of mixing them in a bowl and having one color. Because if you have 3 different colors, it makes it look natural. It makes it look like a little bit of hair stroke and a little bit of shadowing behind. You virtually can't tell.
You taught or teach other people how to do this.
I have.
How varied are the techniques, and why have you chose what you're doing?
Well, I
for the
would
brows?
say that the largest majority of people do a basic tattoo technique. And it looks like a basic tattoo technique.
Okay.
And I want to go that extra step further. So I want to layer in the color. I want to see color just look natural in the face. If you use 1, 2, 3 colors, it just looks more natural.
For the brows, even
Right.
the brows.
Oh yes,
1, 2, or 3
especially the
colors.
brows. Especially the
Now,
brows.
part of this art, and I don't want to put words in your mouth, but the mixing of the colors and your evaluation of those colors is a big part of the result.
Right. It's
Is that right?
It's art. It's an art. It's not a science. It's an art. You have to. If I have 3 clients in front of me, one's going to have yellow undertone in her skin. One might have a blue undertone in her skin. Might have a rosy undertone in her skin. You've got to be able to know the color that you're going to use when you mix it in the skin. What is it going to turn to when the skin heals over it? All that's artistic ability.
Okay.
That was the hardest thing I had to teach in class. Everybody wanted to know a formula. How many drops of this? How many drops of that? That is something you can't teach. That's something you kind of have to know. A lot of people can go to an art class and they can come out and still
draw,
can't.
really.
Right.
So
And
I'm only going to get so good.
Right. Well, it has to be your passion. It's my passion. I love to paint, so I paint faces. I make people
really?
happy. I make people happy all day long.
So the brows, but back to the brows.
Back to the brows.
So you're on the consult.
Right.
Do you draw it in? Do you hear their goals? I mean, what do they say?
Yeah, I talk to them first.
Okay.
I see how they like to wear their brows. Nothing permanently is going to go into their skin until we've decided on shape first. I mean, that would
Shape?
be right.
Okay.
Yeah, shape, size, and color. So I will actually take a pencil and draw it on first to make sure that it's exactly what they want. Once they say to me, Cheryl, I love it, that's how I want it, then we outline it with a sterile marking pen and we duplicate it exactly and we layer in those colors. And that, the end
And this could
product
be a
is
couple of
beautiful.
visits, right, to get it right?
Brows, we usually see people twice if they have no hair, if they have alopecia, if they have a skin condition, sometimes 3 times, but at least 2 times. Right.
Now, how common is it, by the way, that a lot of the women that you see have no hair, no brows?
Well, it's pretty common
Or
because
very, very, very thin.
very common because anytime you tweeze out of the natural brow bone, the hair doesn't come back. It'll come back below and above where you don't want it, but through the natural brow bone, it doesn't come back. So then you've got these very thin brows, and now you're forced to either use a powder or a pencil if you want to put the framing back to your face. So we take that away and put it in permanently, and you don't have to worry about it.
And you give it like a 3-dimensional look like hair. Is
Right,
that right? I
right.
mean, it looks like hair.
Yeah, don't draw
'Cause I feel like
lines.
I could spot penciled in brows.
Right, and you could spot. A lot of people say, well, can't you just tattoo lines that look like hair? I don't
Yeah.
do that either. I put in movement, very fine movement, and then shadow
You put in
behind it with
movement?
another color movement. Like
What does that mean? Tell me about that.
like, well, Randy, you're such a guy. But
Okay.
you don't want to do a straight line. It's not going to look like hair. Hair kind of has a bend and a turn in it. So we layer in the color so it actually almost mimics hair without actually drawing a hard line in the skin, because that looks very unnatural too. You'd be able to see it if I had that.
Okay.
So it's just a layering technique.
Do you think, this is off topic, but do you think women are putting their brows too high sometimes?
Well,
Not
sometimes
just in permanent
if some-
makeup,
it-
just
right. If somebody
general.
comes in with a brow shape that is a little off, I mean, I counsel them, but it's
like
really
you tell them, bring them down a little bit.
yeah, if need
Because
be.
18-year-olds don't have
You don't
these
want
high
them.
brows.
Well, I don't know. My daughter-in-law to be has really high arched brows
Well, I mean, I'm
naturally,
talking
and it's
about really
beautiful.
high, like some of the
Well,
surgeries
nobody
that-
wants to look surprised.
Right,
That would
okay.
be, kind of scary. You just want to look natural. You want to follow your natural brow bone and enhance it. If you've got a higher brow bone, then you enhance that. If you've
Okay.
got a lower brow bone, you enhance that, but you still want to pull them up a little bit. So it's how the angle's put in. And
Is that right?
that
Okay.
can lift and open the whole eye area.
Are men coming in to do their brows?
We do men. My husband has his brows done.
Really?
Yes, and it looks natural, and he's a glass glazier, so he works in construction, and he loves his
Really?
brows. Oh, yes.
Does-
I'm
do
probably
his-
going to get in trouble
do
for
his
saying
friends
that now. I
know?
forgot this is going on TV.
Her husband, do his friends know that he has?
No, they don't know, unless he tells them. They can't tell.
Is that right?
And he likes it because it makes him look younger, right?
Is that right?
Yeah,
Okay.
yeah. We could
So
put
you
a
can't
little in
tell.
yours, and you
I
could
feel
look
like
a little younger.
So if I sat in front of your husband, I would look for it. But you're saying even I'm looking for it, I wouldn't know?
You would not know. You would not
It's
know.
because
I
they-
shouldn't have told you.
Because you thin a little bit on the edges. Or at
Yes,
least,
everybody does. That's
Do you think I need a little bit?
I think you could use a little bit.
Okay. You think I'd be happier? If I,
I think you'd be a little lifted.
okay.
But with men, you have to be very, very cautious too. You have to even be more cautious and layer maybe even 3 sessions lighter so that it never looks like makeup.
Okay, but experience. And this seems like an obvious one. I mean, it plays a role. But are you that much better, 10,000 brows later, 20,000 or 15,000
Well, of
brows
course.
later?
Even the one I do tomorrow, I always strive to be the best.
But
I always
of course, but meaning, are you better as far as making it look better? I mean, are you that much better? Like 15,000 of these brows later?
Well, of course. I mean, experience is the best teacher. Yeah, I mean, there's all different kinds of skin. Sometimes you get cocky and you think, well, I've done it all, and you get a lady that comes in who has very leathered skin. You can't get through the skin. You go, oh, excuse me, So, I mean, you never know it all, but I think, 22 years of experience is a doggone good teacher.
Who would you like to see coming in more? I mean, what kind of client would you like to see more of? Obviously, we're doing this television show, and people need to know this is a real interview. I mean, we're not, we didn't practice at all. I mean, I just,
Right.
I said, let's just talk about this. But
Right.
who would you like to see more of?
Oh, I think the woman that's working, that doesn't have the time, that doesn't spend the time, that doesn't take the time for herself. My daughter is 35 and she's a professor and she's got 2 babies and she has to be on campus at 6:30 in the morning. And it just saves so much time and energy to have that and not have to worry about it. And they don't, when you're raising babies, I know I've had 3.
All successful kids, we should
all
mention.
have grown
and you've
up.
been married almost
I'm
30
blessed.
years, is that
I'm
right?
blessed,
Well,
right?
you're a solid person. I like that.
Yeah.
Good.
So back to it, I think that demographic, I wish they would take the time to do for themselves more. I think that that would be so rewarding, you know, anywhere from, you know, when they're raising children, they don't get up and put on their makeup. They just don't have the time. They don't have the energy. So they just go by the wayside.
Now, is the fear, by the way, that if you're going to do brows, okay, that as you age, there's going to be issues? Or no? I mean, what are their fears with brows? I mean, what are the common fears? What do you hear on consults?
Well, if I get a facelift, will my brows end up in the middle of my forehead? Well, of course
just like
not.
your regular brows, by the way.
Right. If you have hair, if you went in for a facelift and you have no permanent makeup, they got to take that brow into consideration. So that's the number one
You think
fear.
I need a facelift, Cheryl?
No, I do not, Randy.
No,
I do not. No, I do not.
Okay, so they're worried about that. What else are they worried about?
Just that it looks natural, that
And
it doesn't look.
How long does it take? Woman goes in there today, tomorrow?
I tell them to give themselves about an hour.
Okay.
About an hour.
And what's the downtime like?
For the first 5 days when we do brows, they look a little dark, a little too penciled because it's got a healed. We provide them with a medicated makeup to put over it so no one knows. So we cover that for them too. About the 5th day, they're good as new.
Is anybody afraid of pain?
Oh, everybody's afraid of pain.
Okay.
Are you afraid of pain?
Yeah, but I don't know if you know, I mean, does that even hurt, is my question?
Any type of tattooing, you're going to feel it. This is a very gentler, kinder form of tattooing. We have great topical numbing agents. We do them all day long. Eyeliners are our #1 seller. We do more eyeliners than anything else, and you would think that would be the most sensitive. It actually isn't, because the numbing agent works the best on this wet tissue. So when you put the numbing agent on, include it for a little bit, you can get through an eyeliner fairly easily. You know, and if they're hypersensitive and we've got to do a lip, we have a dentist across the street that'll numb them up. So we have, you know, avenues for those that are sensitive, but most people just do it with a topical numbing anesthetic. They go right back to work the same day. So there's no big...
Oh, so they could go back to work the same day. They're not,
there's no big layup, hide in the house, out of commission, period at all.
Moving down. Okay, so brows. And
you need to get off brows and go on to eyes now.
Let me ask you a question, though, because I always tell people that, you know, especially with facelifts or facial fillers or Botox or whatever, you know, 95% of who you are is covered by clothing. And so if they're going to do permanent makeup or they're going to do something like that, you better look for somebody that has a reputation for art and science and look at their before and afters.
Right.
At what they're doing.
Exactly.
And, it's very interesting, because my perception is that you guys are all doing it the same way.
Well, there's so many different ways to do it, and it's just up to who the person feels comfortable with. If they feel comfortable with me, they'll come to me. The main thing is to see it. Interview people. Don't just stop with one.
That's my next question. Brows.
It is like a tattoo, so it will never go away, but all tattoos fade with age. So when you're doing a body tattoo, you want primary color. When you're doing a brow, they are light colors. Browns, taupes, fawns, redheads, they're all light colors. To get a light color, you have to mix. You have to, they're stepped on so many times to get to that color, they're going to fade at a much quicker rate than a body color. But you can't have a body color on the face because you'll look like a clown. Okay. And I've seen some of that. It's not so good. So you just want it to look very natural. The lighter colors have a very short shelf life in the skin. So you want to touch those up. They'll never go away. They'll just get lighter and lighter and lighter of that color. But brows, I would say you want to touch them up about once a year. My theory is you're better having the right light color layered in and maintaining it than having something too dark and too tattooed that you hate, that you have to cover up.
So once a year.
I would say on brows once a year. Eyes depends on the color. All colors are different.
Okay, so moving to the eyes, though. Are we talking about eyeliner?
Eyeliner, top and bottom.
I mean, that's got to be straightforward, though. Right?
No, it's never.
There's different technique with that too?
Yes, there's different shape. And Randy, you just don't know your makeup. There's just different shaped eyes. You know, you have almond eyes, you have round eyes, you have Asian eyes.
The artist that you go to, is there several techniques, or isn't that pretty straightforward? You're just coloring in with a dark color?
You're not just coloring in, but a lot of people do that, but we don't want to do that. We want it to look like makeup, not like a tattoo. And a lot of people don't take it all the way in here. They have little small eyes, so they start out further. We do the darker color to the base of the lash and smudge a lighter color around it. We want it to look like makeup, or how you woke up in the morning, just soft and pretty.
Is that a tricky area, by the way?
Eyes are actually an easy area. Everybody's afraid of the eyes. It hurts the least of the three because the numbing agent.
Right?
Yes, because the numbing agent works the best on the eyes. So it's a really, really nice and fairly
What are the
easy
age
thing
ranges
to do.
of these people doing this?
Same thing. Same thing. you know, anywhere between 35 to 75. I mean,
What's
but
the
we
oldest
do.
person you've done since you've been in business?
She turned 100 when I did her. And many in their 90s. I did.
Are you kidding?
I did a week.
Are you taking advantage of these 100-year-olds?
They love it. She couldn't
serious?
drive, but she could do everything else. I did.
Well,
The other
very
day
nice.
I had
Were you afraid
six women the other morning from 83 to 89 in a row. So you're never, you know,
good for
that's
you.
very young now. That's very young now. That's not old anymore.
That's true.
So and everybody wants to look better. I want to look better.
And what's okay? So you do a 70 or you do an 80-year-old, okay? When it's all done, what do they say? I mean, what's their biggest thing that they're happy about?
Well, some of them cry. Some of them are
you
just,
kidding me?
they're thrilled to have makeup and because they can't see to do it themselves or they're shaky or, you know, it's just an awesome thing. I've done several women that have gone through windshields, automobile accidents, and they're disfigured and you have to try to put the brow back in. We were doing an eyeliner on a gal and actually when we were doing it, a little sliver of glass, just 10 years later, came out of her eye. And she says, oh, that's the best part of having this permanent makeup done.
So while you were doing
yes,
this,
a little sliver of glass came out. She said that has been bothering me forever because I guess it scratched her eye.
Wow.
So, you know, there's a lot of things that you just give back, you know, for somebody who's been through something like that. I mean, they just hug you and cry. You just stand there and cry.
Is this a word of mouth thing? I mean, like those 70 and 80-year-olds that were in there lined up?
I would say most of mine is word of mouth.
Okay.
Because you ask somebody. If I were going to have my eyelids done, a blepharoplasty, I would ask around and I would say, well, who would you suggest?
But unlike that, because some people are, you know, they don't like to tell anybody that they had it done. But with this, do you find that they're like your ambassador? They're saying, hey, you got to get this done. I didn't realize how easy it is, how convenient it is.
Oh, of course
to not
they
have to put
do.
on makeup.
Oh, and every woman I do tells all her friends, and we get their friends. It's like they send one guinea pig, and then they're all like, God, I should have went first. I'd be done already. So yeah, it's a really neat thing. It's a really neat thing.
So, you know, moving down, okay, lips. And then, and then you do a lot of breast work.
A lot
for
of breast
people
work.
with reconstruction. But moving down, okay, lips.
Lips, lots of
and
time.
we are short on time.
Okay, well, lips are also an awesome procedure. You don't have to wear lipstick. We do it very natural too, because if you want to put anything over it, you don't want a bright, dark color that you can't cover. So everything we do is natural.
Yours is very light, by the way. There's no lipstick on there at all?
No.
Okay.
No, and it can be done. I mean, some people want a little bit darker, but I always, if somebody wants to come in and have a fuchsia or wants to come in and have a burgundy, I always talk to them because
you talk them out of it.
Yeah, because what if you want to change your idea, or 10 years from now you're 80 and you want it a little lighter. So I always counsel them too. Less is better.
Okay.
In my opinion.
I'm going to ask you the same question I asked you earlier, but I mean, does technique play a role there? I mean, that seems like an easy one. Like you could teach me to do lips, right? You just
a lot
follow.
of practice. No, Randy, you have to layer it in, because if you just draw a lip, you're going to see the lining. You're going to see it's not going to look natural. It's not going to.
And that happens?
Of course it happens. I don't think. Of course it happens. And I just feel better if somebody goes out looking natural, because I know that that's what's going to sell. I know.
How long can the lips last?
Lips last forever too. None of it ever goes away. It just
I mean,
fades.
Okay. Are they the most pleased? I mean, when you talk about customer satisfaction, is it the eyes, the brows, or the lips?
There's very few that start with one that don't do the other two.
Oh, really?
Right, because once they have one, they go, that was easy. I want to do the other ones. It's kind of addicting. Same thing with body tattoos.
Okay.
That's why there's so many.
Lips, excruciating pain?
Lips are uncomfortable, but they're not unbearable.
Okay.
You don't believe me.
I threw that in, by the way. I don't even know.
Anything that you do underneath the nose, you're going to feel it more. Electrolysis, anything like that. But it's not intolerable.
Pain to the point of,
oh gosh, no, it's not that bad. It just
Does
isn't.
Botox hurt more than? Because I've had Botox and I'm in pain.
It's about the same, but Botox is a little quicker.
Okay.
Botox, you're in and out in 5-10 minutes. This takes a little bit longer, so a little bit more discomfort.
You like the lips? You like doing the lips?
I love the lips. I love it all.
But usually they do all three. They do the eyes, they do the lips.
Yeah, and many of them will do all three in one sitting.
Okay. And scars. Any scar on the body?
Any scar on the body that isn't hypertrophic and isn't dark. So you want a hypopigmented scar that's gone white, because to try to lighten a dark scar, you're just going to work it to death, and it's not done yet. Once it goes white and it hypopigments, then we add some flesh in there and can camouflage it, and that's just very nice.
But breast, big part of what you do?
Right. It is a big part of what we do. Reconstructive surgery is kind of traumatic, and it's a choice that a woman has. She can actually choose the color of areola now if she wants it pink or brown.
I mean, is this where art really plays a role because you're drawing
it really
on like
is
a three-dimensional looking
it's all art.
nipple area?
In my opinion. It's 1/3 technique and the rest is art. You just have to have an eye for it. You just have to know how to blend. You have to know how to mix. You have to look at it and know. You have to be able to assess it by looking before you go into it. You can't guess at this stuff. You know.
And you have
it's
pictures.
permanent.
You have pictures to show people.
Oh, thousands and thousands and thousands of pictures. Absolutely.
Okay, good. And you're involved in a charity as well.
Yeah, we're just setting this up, the Sheryle. So my girlfriend's daughter, went through a very scary thing with her. You know, a very possible cancer scare, and the City of Hope just treated her so well. So I'm going to work with her oncologist, sharing hands around you, and what we're going to do is provide a brow or an eyeliner procedure for somebody who the physician feels it would benefit them, their morale, and they'll come in before they have their chemo, because they're going to lose all their hair, and they're going to lose their brows, and they're going to lose their lashes, but the lashes will always come back. The brows usually don't. So it's just something to give back, that I want to do to give back to society.
Okay, good. Well, I want to thank you for always a pleasure to have you on the show.
Thank you, Randy.
Is there anything we missed? We talk about eyes, eyeliner, lip color, plastic surgery scars.
I can't think of anything that we've missed.
And you're the desert's leader. You know, people always say, you know, they always want a referral. They go to wellnesshour.com. And I try not to give referrals, but I say, look, go to somebody that this is their specialty. Go to somebody with a lot of experience, but look at their work.
Come in and see us.
Because it is,
Come in
you've done
and see
almost
us.
20,000 procedures, right?
Yeah, I've done 19,900 and some odd procedures to date, and they can come in. We've got the proofs in the pudding. So you want to come in and see it, come see us. We all have it.
And you have a
we'll
free
share with you.
consultation,
Oh,
right?
absolutely. Absolutely. Take all the time you need. We'll draw them on for you, show you what we're going to do. And we don't high pressure sell. If you want to have it done, we want to do it for you. If you don't, we're not going to pound you in there and not let you out the door, so just come see us.
Okay, good.
Seeing's believing.
I want to thank you for coming on the show.
Thank
Always
you,
a
Randy.
pleasure. Always a pleasure. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview with Sheryle Taffola again, you can just go on our website and put in permanent makeup. For now, I wish you good health.